Dr. Joel Fuhrman, somebody, after you sat with him for the interview, you were talking quite a bit about that interview. So what left the impression? What was it?
This guy is fiery, knowledgeable, confident, certain. He treats a lot of people. He's seen a lot of things. He literally took my shoes off my feet and rebuilt my orthotics, before he let me walk out of the house. Just a lot of experience. His interview had a profound impact on me that literally he changed my mind on the way people should eat to prevent cancer, to treat cancer. And it's had an impact on Dory, it had an impact on me. This is a really good interview with a really smart guy.
Yeah, so good interviews with smart guys when you're exploring the subject of cancer, I'd say is a really good idea to tune in and pay attention. Listen to and watch this interview with Dr. Joel Fuhrman.
Dr. Fuhrman, thanks so much for being with us today.
My pleasure.
So tell us a little bit about your history, how you got here.
Well, I've been a medical physician specializing in nutritional medicine for more than 30 years now. I'm here in San Diego at my retreat where people come to stay for usually a month to 1 or 3 months because they usually have some medical condition or they're overweight with food addiction. They want to really learn how to eat, ideally make it taste great, remove their cravings, and learn how to be able to stick with this long term. Because what I teach people is that dietary excellence in the short run doesn't benefit you. You have to maintain it in the long run for the rest of your life if you really want to see the profound benefits. And so if people can't maintain it, it's really of no value. But how I got here? I was on the world figure skating team. I was third in the world in pair skating with my sister in the 1970s. I was injured and couldn't walk for almost a year as part of my athletic experience, which probably curtailed my ability to get into the 1976 Olympic Games because of my injury. Because I was ranked number 1 in the country in 1974. And then because of my being out unable to skate in 1975, wasn't in great enough shape to get back for the 76 Olympics. Because of that type of training and education, going to college during that time, I did not have the pre-medical requirements as an undergraduate. So because I learned about nutrition while I was young, and my father made recovery from some serious illnesses when I observed that and was into nutrition for my skating career, for athletics, for stamina and strength and not getting sick. I was reading a lot about nutrition books from my father who was overweight, and I started to have a passion for it and interest in it. Then I met my wife, who wasn't my wife then, who we started dating, and she was going to attend medical school, and she said, well, why don't you, if you're really so passionate about nutrition and being a doctor like this, why don't you just have your father sell the business, the shoe business, the 10 shoe stores I was running and at that point, and go back to school, because I hadn't had the pre-med course. I thought it was kind of like almost impossible to go back to college and get all those requirements over again.
Right.
So I decided to do that. And I, changed my life, went back to school, to the postgraduate pre-med program at Columbia, and applied to medical school and went to the University of Pennsylvania School of Medicine with a specific intent to be a doctor specializing in nutritional medicine. And that was, I graduated from medical school in 1988. I was already in my mid-30s by then. And for the last 30 years, I've been having, continue my passion and excitement in enabling people to reverse serious illnesses and recover their health from what are primarily dietary-induced problems from eating the way other Americans eat. I always tell people that we've landed the man on the moon already. And what I mean by that, we already know how to win the war on cancer. The answer is vegetables. But people don't like that answer. They want a different answer. They want to be able to smoke 3 packs a day and take a magic pill and not get lung cancer, or to be able to eat pizza and pasta and burgers and bacon and hot dogs and croissants and bagels and not get breast cancer or prostate cancer. And it's never going to happen. Life is not a fairy tale. We become what we ate. And we're eating to get cancer, we're going to get cancer or get other diseases that are the result of nutritional ignorance. But the exciting thing is that nutritional excellence and the diet style I recommend, called a Nutritarian Diet, is designed to maximally slow aging and extend human lifespan, and it also becomes most therapeutic then to help people reverse disease.
So this is an area in the marketplace of massive confusion. And where it really gets sharpened to a fine point is when someone becomes ill. So the confusion exists. What diet should I be on? How should I be eating? Is it the ketogenic diet? Is it? And you hear experts on all sides, each saying the other side is wrong. But when someone's facing cancer, and I want to talk about prevention in a minute, but when someone's facing cancer, all of a sudden this confusion is really costly. If somebody is at that stage, what would you tell them, and how can they know you're right?
The first thing we have to establish is that it's a fallacy to think that the diet that's most preventive against cancer is different from the diet that's most effective against cancer. Let me say that one thing that's well established in the scientific literature, that the same foods that most effectively prevent cancer enable people to live longer, prevent cancer recurrence, and even allow cancer reversal and the body's immune system to maximally defend itself against cancer. When you have cancer, there's not two different programs. There's not one program to reverse heart disease. There's not one program to prevent heart disease. And then when you get heart disease, you have another different program that's more effective to reverse it. That is incorrect. It's illogical and it's false. We know that when a person, for example, I'll give you an example. We know that flax seeds have been shown to show preventive effects against breast and prostate cancer. We've also found that when people have breast cancer and they're followed for 10 years, those women consuming 1/3 of a milligram of lignans from flax have a 71% reduced risk of dying from breast cancer. And that 71% reduced risk of dying because they have some lignans from flaxseed you're underestimating the power of the flaxseed, because if you had that food before the person got cancer, or they started that food when they were 30 years old, 30 years before they got the diagnosis of cancer, it would have been even more effective. What I'm saying is that we know from the WHEAL study, the Women's Healthy Eating and Living study, for example, that women who had a bigger catabolic window at night, where they finished dinner earlier and had more than 13 hours between the end of dinner and the start of breakfast, had reduced the risk of having breast cancer recurrence by 31%. They didn't even eat differently. They just ate an earlier dinner. We know that when people do the same thing before they get cancer, it reduces the risk of getting cancer. I can give you one example after another with regard to mushrooms or onions, whatever the subject may be. The studies show that when something helps people who have cancer, it becomes very preventative to people getting cancer, and vice versa. And this idea that the diet would change, that when you get cancer, that's just, yes, you want to make the diet optimized, but it's still the optimal way a person should eat without cancer. So, for example,
great point.
In the Women's Healthy Eating and Living study, for example, they found that vegetables were the food that offered the most protection against cancer, meaning these women had cancer, and they found that the more green vegetables they ate, the longer they lived. Vegetables were protective in toto, but the green vegetables were most protective. And that adding fruit to the vegetables increased the ability to fight cancer, reduce deaths, and reduce cancer recurrence. That means removing the fruit out of the diet makes the vegetables less protective, not more protective. We know, for example, there's dramatic protection from nuts and seeds against cancer for multiple reasons. That nuts and seeds facilitate the absorption of phytochemicals and antioxidants from the green vegetables in the salad or the wok green vegetable dish you're eating. That when you have some fat in the meal from walnuts or flax seeds, the fat just helps you absorb 20 to 50 times as many phytochemicals, and a lot of these chemicals are fat soluble. When you eat them dry with no fat with the meal, you're not going to get as much protection. But oil doesn't have the same protection as the nuts and seeds. There's a lot of phenols and sterols and stanols and fibers that slow the absorption of the calories from nuts and seeds into the bloodstream, maintaining their effects for hours and taking out, actually removing inflammatory fats and saturated fats out into the toilet bowl. What I'm saying is that walnut oil is not the same as walnuts, and pecan oil is not the same as pecans, but we find that walnuts have legitimate scientific evidence that they have powerful anti-cancer effects when added to an otherwise healthy diet, which you're not going to get the same benefit from adding walnut oil to it. What I'm saying right now is something else that answers that question. We give more credence to studies that have three different criteria. One, you have large numbers of people, not 100 people, not 50 people, but 10,000 or 100,000 people are in the study.
Right.
Number two, the study goes on for decades. 10 years, 20 years, 30 years. The shorter the study is, we're looking at effects that are soft endpoints. Soft endpoint means the person followed this diet, like a keto diet, and they lost weight, and their blood pressure went down, and their triglycerides improved, and their diabetic parameter went down. But that's almost meaningless, because we didn't follow that person for 30 years and see how long they lived. If that diet that caused them to lose weight now increased the risk of prostate cancer by 30%, not only is it not good for them, it's not good for any person with prostate cancer. And that's what the studies show. They show, number one, they show that, and I'm saying here the studies that look at hard endpoints, the third criteria is the study has to look at hard endpoints, and that means things like death, diagnosis of cancer, heart attacks, or strokes, something that resulted in an endpoint that's quite severe, usually death. We know that there was a study on about 130,000 Asians that looked at death as the endpoint, and they found that green vegetable consumption had the most positive effect at extending human lifespan. We also have studies that show the tremendous power of green cruciferous family, especially the ITCs, the isothiocyanates that come from green vegetables, at preventing cancer, and also extending lifespan in people that have cancer, and reducing the expression of the GSTP1 gene, the BRCA genes that people have inherited, these bad genes that increase the risk of cancer, and we know that that gene expression is suppressed and unable to cause a problem when you have a diet high in green vegetables. And it shows no threshold effects, which means that as green vegetables increased from the first quintile to the second, third, fourth, and fifth quintile, there was no leveling of the benefits. The benefits kept going up at the same rate. Whereas with regard to mushrooms, have a tremendously powerful beneficial effect, but they level off at a certain point. So going to the, once you add a certain amount of mushrooms, additional mushrooms after that are not going to have additional benefits. That's not what green vegetable consumption shows. The diet has a higher proportion of green vegetables. Even at very high levels, we still see benefits occur. The points I'm making here are that, number one, the blue zones around the world identify areas of the world where they live the longest. But those areas of the world are not eating ideal diets. They're eating diets that are haphazardly designed based on what's grown in the area, what their ancestors ate, and those diets just happen to be about 10 years, people are living about 10 years longer than the average American is eating, because the American diet, I say, has been designed by ISIS. It's the most dangerous diet a person could eat. All Americans are overweight, sickly, riddled with cancer, and they die of heart attacks, strokes, and cancers. It's the worst diet a person could possibly eat. But what I'm saying right now is, we have the ability to look at those factors, the individual criteria of each blue zone, and see what are the weakening factors, what are the strengthening factors, what are the good things they're doing. Modern nutritional science has advanced to the point we could identify the full portfolio of foods that maximally prevent cancer when put together in a certain diet style, and which foods weaken that portfolio. And we know, beyond a shadow of a doubt, oils and empty calories weaken the portfolio. Whenever you pour calories into the mix, into that witch's cauldron of disease causation, excess calories are dangerous, particularly when the calories don't contain a significant load of micronutrients. Where's the compensatory benefits of those calories? You just dumped 1 million of empty calories in there. What I'm saying right now is that we can divide food into 3 different categories. Unrefined plant foods that contain fiber and a mixture of phytochemicals and antioxidants and a full load of different types of micronutrients in all these different plants. And then we have processed foods and animal products. And I'm saying right now that a bagel is like a piece of chicken, because they're examples of foods with no significant micronutrient load, no fiber, no phytochemicals, no antioxidants. They don't have that protective, so you're taking in calories without a nutritional benefit. Plus the fact, it's not the only problem with animal products and processed foods. They also are hormonally unfavorable, meaning they promote cancer, because the processed carbohydrates promote a high glycemic response, which means your sugar goes up and your insulin goes up. And insulin is a growth-promoting hormone that promotes angiogenesis. And angiogenesis means the growth of new blood vessels. Insulin, an excessive amount of circulating insulin, says to the body, you're okay. go ahead, get cancer. Because cancer cells are cells that have become bizarre and abnormal behavior that are trying to replicate abnormally, but can't replicate well unless they have a blood supply them with nourishment, calories, and oxygen. And they emanate angiogenesis promoters, which cause blood vessels to grow into them to allow the cancer to replicate. Green vegetables, beans, mushrooms, onions say, no way, Jose. They're anti-angiogenic. I'm not letting that cancer get a blood supply. Whereas the sugar does the opposite. The high glycemic carbohydrates, the honey, the maple syrup, the fruit juice, right? The white bread and the pasta and the white potato. These white foods, high glycemic carbohydrates, have a glycemic response that allow insulin to get to levels that allow the body to raise angiogenesis or enable angiogenesis to occur. Where I'm saying right now that the lower glycemic plant foods, which are not processed, they're whole foods and have the full fiber intact, don't allow insulin to rise that high and don't change the shape of the insulin receptor and make you more and increase the rise of insulin. Whereas any fat on the body, any additional fat over than what let's say a male shouldn't be more than 10 to 13% body fat. That maybe 1% of Americans meet that criteria. You know what I mean? A female shouldn't be probably more 20% body fat. Maybe 2% of women or 1% meet that criteria. We're talking about an American population that's ubiquitously overweight, and the overweight condition promotes cancer because fat cells block insulin, but also secrete lipokines, cytokines, and secrete transmitters that permit and promote angiogenesis. So fat cells say, go ahead, if your cancer want to grow, I'm letting you grow because I'm fat. I have fat on my body, and fat cells are promoting the angiogenesis factors that allow the cancer to reclaim the blood supply. What I'm saying right now is that just like a bagel is hormonally unfavorable, that piece of chicken, likewise, is hormonally unfavorable too, allows cancer to grow. Because the chicken promotes IGF-1, insulin-like growth factor 1. And when your animal protein intake goes above a certain level, and that level is different from person to person as to what level when IGF-1 will start to raise to a more unfavorable level, just like insulin raises. And then IGF-1 becomes angiogenesis promoting and growth promoting. That's why all these animals that eat plants, they don't eat plants their whole life. In the first 6 months or when they first start out, they wind up eating mother's milk with a higher protein concentration, with an amino acid pattern to promote high levels of IGF-1 to maximize growth in the baby so they can get to be a bigger animal quickly before they're eaten by another animal before they can care for themselves as quickly as possible. Nature set into motion a whole system where animals can rapidly grow, but they don't drink mother's milk or have these growth-stimulating foods once they've grown to a certain size. Once they can protect themselves and care for themselves, they're no longer growth-promoting, because if we start to have growth-promoting substances when there's an adult, you're going to promote the growth of things that shouldn't be growing, like your waste or cancers. What I'm saying right now is that a piece of chicken is like a bagel, because they both are micronutrient deficient and don't contain the positive factors that fight cancer, and they're both hormonally unfavorable foods. They both promote the excessive circulation of hormones that promote cancer. The bagel promotes excess insulin, because it's high glycemic, and the chicken, because it's concentrated protein, promotes too much IGF-1. Now, why should you accept that? Because that's a theory, and we're talking about the reasons why those foods are beneficial, but then we have to look at studies. Let's look at people who have varying degrees of animal products, lower amounts to more moderate amounts to higher amounts. And we see that those studies that modulate the animal products show that as animal product intake goes up, so do IGF-1 levels. Another soft endpoint that makes us think it could be dangerous, but it also increases death, both cardiovascular death, cancer death, and all-cause mortality. In other words, anyone advocating an animal product-rich keto diet has no data to support it, zero, because they have to only look at short-term studies showing soft endpoints. Because every study, all of them, not one is an exception, that looks at long endpoints of people eating high consumption of animal products show increased risk of death. And there's no such thing as defending that away and saying, well, that's because people followed it long-term preventatively, but when you get cancer, it's more effective to eat all those animal products. That's stupidity. and insanity. So that's the basic factor, but let me expand it a little more and say that when we look at a dietary portfolio of anti-cancer foods that includes the full exposure to G-BOMBs, G, B, O, M, B, S, acronym that identifies the foods that have the most scientific support to protect against cancer. Not all vegetables are protective against cancer as much as others. So the G-BOMBs identify G for green vegetables. Greens, beans, onions, mushrooms, berries, and seeds with an incredible preponderance of evidence showing their powerful effects to prevent cancer and extend human lifespan. What I'm saying right now is when we narrow the dietary portfolio by removing, let's say, the fruit, the berries out of the diet, you're not going to eat loquats, you're not going to eat kumquats and pomegranate and sour cherries, and you're not going to eat. When you remove those phenols and polyphenols that are rich in those colorful fruits, the wild blueberry, when you take those out of the diet to make the diet more ketotic, let's say, you've increased the risk of cancer. Number two, when you take nuts and seeds out of the diet to lower the fat, because some guy had an idea, it's better to eat the plants but not to have any fat in your diet. That's better. Well, that's what the studies show. All the long-term studies show when you take the nuts and seeds out of the diet, you increase the risk of both cardiovascular death, cancer deaths, and all-cause mortality. When you take the green vegetables out, the beans out, what if you pull the beans out? Well, you would just increase the risk of death. What I'm saying right now is narrowing the dietary portfolio to a smaller choice of foods makes it worse in most cases. And certainly we're seeing right now that we have a unique opportunity in human history to live longer than ever before because we have an opportunity to use a full dietary portfolio of anti-cancer foods that we didn't have available to us years ago. We couldn't get green vegetables and asparagus in the wintertime. We couldn't juice kale, collards, and bok choy and add some tomato and carrot juice to it and lettuce juice to it to make a drink. We couldn't do those things. We didn't have juicers and refrigeration. We couldn't get wild blueberries and all year round and import those little baby kumquats to prevent cancer. We couldn't design the full diet style to be as clinically effective as we can today. What I'm saying now is this opportunity gives us the ability to not have fear, to not worry about cancer, to live a long life, not have heart attacks, not have strokes. And if we did live wrongly, or we did develop some unusual disease like cancer, it gives us the ability to tweak our diet and hone it down to nutritional perfection or excellence to give us the maximum chance possible to either slow the advancement of that cancer, prevent recurrence of the cancer, or even in many cases reverse the cancer. But what I'm saying is that there's not a lot of controversial issues here, because if you review all the data from the full preponderance of studies, they all point to the same outcomes. There's not a lot of controversy. The controversy is among people giving opinions. And what people their bias and what they've been promoting for years, and they don't want to change what they've been promoting because they don't want to modify their recommendations when new studies become available. But what I'm saying right now is, as the new studies become available, they always show the same thing. They always support this notion that more vegetables and more of these high nutrient plants, these plants that have a high broad amount of these protective phytochemicals, have powerful anti-cancer effects and increase human lifespan. And more animal products and more processed foods and more oils shorten lifespan and interfere with the ability to maximize disease reversal.
So it sounds like to me that you're basically describing a diet for wellness, whether it's from heart attack or cardiovascular disease or cancer. Is it pretty much the same nutritional prescription?
Yes. In other words, what I'm saying is that there's not one diet that reverses heart disease, prevents strokes, and another different diet that reverses cancer. That's just ridiculous. These diseases are all the result of nutritional ignorance and bad nutritional practices. And if you're eating right, you shouldn't have a heart attack, you shouldn't ever get a stroke, and you should never get cancer either. If you're eating right, you should be protected against including dementia. The healthiest diet is healthiest for all those major diseases, and that's the whole beauty of this. You have cancer in your family? Well, you can eat a diet that prevents you from heart disease and cancer and dementia. You have dementia in your family, eat the anti-cancer diet. Absolutely, that is true. But of course, we have some people that are maybe slim, large males who are athletes who need more calories. And there are people that are overweight who have slow metabolic rates, that need their calories ratcheted down and have to improve the nutrient density and lower the caloric density of their diet. Some people have to increase the nutrient density, and we all have. So there's some modifications that are done, and there are some genetic influences that make for moderate modifications that might be appropriate for individuals. But those modifications for individual needs don't change the overriding context that your diet has to be rich in the G-bombs and the anti-cancer foods, and the animal product consumption has to be moderated to low levels, and in some cases eliminated. And that for everybody, whether you're overweight or not overweight, or then it still makes processed foods and contaminated foods and toxic foods and chemicalized foods and are still not good for anybody, you know. Except as an exception. Maybe the exception is a person who has anorexia nervosa, who's got aversion to eating calories, maybe adding some oils to their food to increase their caloric density of their food diet because they're too thin, might be the exception. But that's an incredibly unusual exception. It's almost never the case that walnut oil is better than a walnut, and avocado oil is better than avocado, and sesame oil is better than sesame seeds. No nutritional scientist in the world could defend the use of oils in a diet, because it's always the case that the whole food that made that oil is a healthier source of that fat, because it contains a full complement of nutrients that give you extra benefits and slow the absorption, the utilization of that fat.
So to put this into practice, you were saying it doesn't do any good to make these short-term changes. You've got to. How in the world, if somebody's persuaded by what you're saying, okay, I want to do that. Now they're confronted with that. Do I spend my life eating salads or what? How does this work in practice?
Well, I've written 12 books on that subject.
So that's a good start.
And my latest book is called Eat for Life. It's my latest book because it's the last one I just finished, which has the most modern and fullness in the nutritional research and support, so it's more definitive, and I think some people should probably start with the latest book rather than one of my earlier books, because there might be some tweaking of over the years. But still, I wrote a book against cancer, superimmunity, back 5 years ago, and I've written a book of the end of heart disease, the end of diabetes, that are tweaked to make the diet glycemically more favorable for a diabetic or something. Small adjustments of the diet to make it more disease reversal. But my message is, don't satisfy with being sick. Don't take drugs the rest of your life. Drugs cause increased risk of cancer. The blood pressure medications cause increased risk of cancer. The calcium channel blockers, the statin drugs lower your cholesterol, increased risk of cancer. So we're talking here about, you go to doctors and you get drugs that increase risk of cancer, and they don't remove the problem anyway. They give you their permission slips to keep eating the same diet that caused the problem to begin with. Well, people walk around overweight. And then people walk around with this idea in their brain that they're eating right and they're all overweight. You're not healthy if you're overweight. No such thing as a healthy overweight person. What I'm saying, that a nutritarian, the word I'm using to describe my dietary portfolio, the one I'm recommending to people, means that you achieve an ideal weight. And if you're not at your ideal weight, you're not following the program. Or you're on your way to your ideal weight, of course. But if you're not losing at least 2 pounds a week, you're not on the program. If you're overweight and your weight's not dropping, you're not on a healthy program for you. Because if you're eating something that's maintaining your weight in an overweight condition, then you're maintaining yourself in a condition that's not healthy. Your diet to be effective. So one way, simple way, please see if they're following my approach, is either they got to an ideal weight, or they're losing at 2 or 3 pounds a week, moving towards their ideal weight. You can be overweight, a nutritarian, because you're getting there, but you're getting there gradually. When you get there, your weight loss pretty much stops. People are totally confused about this. They have no idea. What I'm saying right now is that when you eat more calories, it speeds up your metabolism as a means of burning off the excess calories you consumed. But speeding up the metabolism of the body is aging you and helping you promote cancer. What I'm saying right now is, if I consumed an extra 200 calories a day, that's 3,500 calories per pound. About 350 days in a year. That means every extra 100 calories a day adds about 10 pounds of body weight a year, which means about extra 200 calories a day means 20 pounds of extra weight at the end of the year, right?
Right.
Wrong. Because what the body does, it doesn't want to put on those 20 pounds from all the extra calories. It tries to figure out a way to get rid of some of those calories so that they gain that much weight. So it speeds up the metabolic rate. It'll increase the respiratory quotient, the calories lost with breathing. It'll rev up your thyroid a bit. It'll raise your body temperature. It'll set into motion an attempt to try to burn off some of those calories consumed so your weight doesn't go up that high. But those biological changes the body has to do to try to burn those calories, is shortening your lifespan and increasing the risk of cancer. Now, let's say myself weighing 150 pounds approximately, let's just say, for example, I need 1,500 calories a day to maintain this weight. So what if I have 100 calories too little, 1,400 calories? Well, 100 calorie deficit for a year, I'll lose 10 pounds, right?
I'm not falling for it again.
No, because my body will slow down the metabolic rate so it doesn't lose all that weight. So it'll reduce the respiratory quotient, it'll lower my body temperature, it'll reduce my thyroid function. By the way, in the lower half of thyroid, the range of normal, in the lower half of normal, you have half the heart attack rate compared to the higher half of normal. See, the reason I'm saying this is because the population out there thinks they're looking for tricks and gimmicks to raise the metabolic rate so they can eat more food and not be too fat. But what the real answer is there's no magic, and you can't buy thinness. What we really want to do is slow down our metabolic rate with a moderate caloric reduction so we can slow down our weight and not have to eat so much food to maintain our weight. We want to be able to slow our metabolic rate so we can maintain our favorable weight without getting too thin. We want to eat a diet with a high micronutrient per calorie density. You don't want to give the body extra work to do. You want to meet its caloric needs and meet its nutritive needs with no excess calories. They always say, they said I think it was written in the old ancient Egyptian pyramids that the longer the waistline, right, the shorter the lifeline. And what I'm saying right now is the excess calories you didn't need, feed your doctor. Did you follow that?
Got it. I'm still back on you can't buy thin. I couldn't, and I don't want to be unkind to Oprah at all, but Oprah is really wealthy and has struggled with her weight.
She's a food addict. She called me on the phone once. This was about, I think, 5 years ago. She read my book, Eat to Live, and she called me on the phone. I was sitting there with my family, and I said, Oprah? And she said, I'm so excited to hear from you. And she said, I'm so excited to talk to you. I want you to know I'm eating to live. I said, great, Oprah. Anything I could do to help you, I'm here for you. I think that was our last conversation. I don't know, I think she might have contacted my staff or be in communication a little bit after that. We sent one of my chefs to go help her and her staff learn how to eat healthy. But she didn't stay with the program. For some people, they have this craving for an addictive relationship with food, and this illicit love affair with food that kills them, right? And the food doesn't love them back. That's a joke.
Well, yeah, but you're sitting across from somebody that you're probably describing, and so I'm processing it. So how does someone?
By the way, I just want to say, and the food are designed to hook people.
Yes.
They design them to be calorically concentrated so the calories come in very rapidly so it signals dopamine in the brain. They add extra salt and sugar to them to make them more addicting. They put oil in the food. They fry foods to make them more addicting to people. And then the people feel that they can't change because it takes over the primitive brain, just like snorting cocaine does. And that's what my expertise has been over the last 30 years, is developing programs to remove people from being chained to their food addictions, to retrain their food preferences and their likes, and to make the food taste great, and to make them lose that love affair with the foods that are killing them. I never got that chance with Oprah. She read a book, she called me on the phone. She really needed some extra help from me, personally. Never met with her, of course. It was just a quick phone call. But I feel I could have had a meaningful effect on her life and could have changed the trajectory of her life to recognize that it's not about feeling satisfied with being overweight and loving bread and realizing that what she did is she checked out of the process, what people do. They fail so many times on various diets that they give up and they try to convince themselves it's better to just be happy and to just not worry about it and to just eat what you feel like eating and be overweight. And now you have this whole, this political movement of trying to convince people that it's healthy and good to be overweight. And they call it, don't fat shame people. It's not fat shaming people to give people to be honest and telling them they're increasing the risk of cancer by being overweight. That's just giving people the information they need to know to make the right decisions. But what I'm saying is, what we do here at this retreat and what I do in my medical practice, I have food addiction counselors. We have books written about it, like The End of Dieting, why people keep dieting, go from one diet to another and they don't get there. What are those factors that create food cravings? Physiological dependency on unhealthy food, and emotional overeating, what causes that? how to remove that and how we get people to really love to eat healthfully. And that's what I do as a profession, as a career, is not just tell people eat healthy. I remove the obstacles to achieving that, make it easy and desirable and taste favorable and make them happier and prefer to eat this way. And even though I said we should be eating less calories, when you supply the body with such a robust amount of nutrients and fiber cooked in ways that are preferably maintaining the nutrients there, it naturally diffuses the desire for so many calories. I'm not saying people have to walk around starving themselves. I'm saying when you eat right, it takes away your cravings and desire to overeat. And that when you tweak up the nutritional concentration of your diet, it'll naturally instinctually remove your desire to overeat calories to get rid of where you got to the place you're at with too much weight on your body and too much calories in your system. One of my patients, her name is Pam, she came to me with stage 4 ovarian cancer 25 years ago. 25 years ago, given 3 months to live, with 4 liters of fluid, of ovarian cancer fluid in her lung, had to be extracted with a needle so she could breathe, given a few months to live again. And now she's thriving and still healthy, past the age of 75, 25 years later. That's the proof. That's what shows the effectiveness is, you got to look at people out 10, 15, 20 years, seeing how they're doing and how they're surviving. But in any case, the point I'm making is that cancer has a series of causes. It's not magic. It's understandable, and it has causes. And if those same causes are continued to be exposed to, once a person has a diagnosis of cancer, it's going to be even worse, for those people. But of course, cancer is a bizarre disease, and the more advanced it is, we have less ability to guarantee the results that are achievable. The earlier you catch it, the more you have a higher probability of reversing it. But nevertheless, even in later stage of cancers, we still slow the cancer, prevent recurrence, and enable people to live longer who have cancer. Not making the claim that all people can reverse their cancer with the nutritional excellence of this protocol. But I am saying, in my years of practice as a family physician, and I'm saying family physician intentionally because I'm not an oncologist, means I haven't seen thousands of patients with cancer. I've just seen a few hundred, you know what I mean? And of the few hundred, the amount of people that have reversed their advanced cancers and their moderate cancers is phenomenally high percentage of people that have done well. You know what I mean? That have had remarkable results. I could show you one case after another, from stage 4 melanoma going away to people with stage 4 lymphoma. Another patient of mine, Irene, has stage 4 lymphoma that no chemo and no treatment, just did the program, and within months it started shrinking, and within a year it was totally gone. Another man who had stage 4 melanoma reversed itself completely, and another man who had ulcerative colitis, of course, who had developed testicular cancer, I think from the drugs he was given for his colitis, which those drugs for autoimmune disease cause cancer. Right. And then he couldn't take the drugs for the cancer because the chemotherapies would flare up his colitis, so he decided to do this program, and you know what happened? His colitis went away and his testicular cancer went away.
Wow.
So I've been exposed to enough experience in this field, not the most experience in the world, but enough to see that we don't give up on the body's ability to reverse disease, because even in these advanced cases, I've seen people make miraculous recoveries. And of course, predictable recoveries when you get them earlier in the process. And we're not just talking about cancer here, we're talking about reversing heart disease, and people melting away to the blockages, told the angioplasty or bypass surgery, or people even in early stages of heart failure or cardiomyopathy that reversed itself. And we're talking also about reversing autoimmune conditions like lupus and psoriasis and scleroderma and Sjogren's syndromes and these diseases, rheumatoid arthritis and ulcerative colitis, that people can get well from these diseases and not put on cancer-causing drugs for the rest of their life, and given the only option that they're ever given is to be put on drugs that we know cause cancer. We know the drugs for autoimmune disease cause cancer. It's well accepted. It's not a controversy among the medical profession. That's why people are told that the drug can increase the risk of cancer, but they have to take it because there's no other option. And my objection to that is people shouldn't be resorting to those drugs that cause cancer until they're given the nutritional option and at least said, I don't want that, or failed it, because you don't put a person on a cancer-causing drug without showing them that they can get well and giving them all the options available to them. So I'm passionate and adamant that people at least have to learn about this so they can have informed consent to make the right decision for their life.
Great point. So you mentioned retraining your taste buds, and it's an interesting thought. That of retraining your taste buds. Can most everybody do that? How long does that take? To put this in practice?
That's correct. That the diet that's heavily salted and heavily spiced and heavily sweetened deadens the taste buds for sugar and salt and the lettuce has no flavor. An avocado has no flavor. Cashew nut, doesn't taste sweet. A strawberry or a wild blueberry is not sweet enough for people. What I'm saying is that people have weakened their taste buds, and we teach people incredibly delicious recipes. I've got these years of experience making recipes taste great, but I also have the contribution of world-class chefs who've adopted this Nutritarian program, who've put recipes in, and I have thousands of members on my website who've contributed recipes, and people have rated them. In other words, we have a long track record of making healthiest foods taste great. But your question is saying that the taste buds change and your food preferences change and your taste strengthens. So the food that you were liking from these recipes we're giving you, actually you like it more after a period of time, and we see a major change in taste within a 3-month period. But that 3-month period still continues to improve until they're 6 months out into the change process. When a person comes to see me with a significant condition, I say to them, do you want to get rid of your diabetes and drop the 50 pounds, or do you just want me to modify your medication and stay half sick and lose a few pounds? And they say, no, I want the whole kit and caboodle. I want everything. Get me well. Let me drop 50 pounds in the next 3 months, and I'm going to get well again. And I'll say, okay, then don't decide what to eat. Don't think what you should eat. Don't think what you're supposed to eat, what you feel like eating, what you like to eat. I'm deciding that. I'll decide what you eat. If you're not sure, get in touch with me. Because what you were deciding and your decision-making got you here, And I don't care if you don't like it or not. Because I'm going to prove to you you're going to love eating this way if you do it for a while. And I'm going to prove to you, you're not giving it a test unless you do it. You've got to do it whether you like it or not right now. You're not going to like it the first week or two you're eating it. You're not going to love it right now. Don't think about that. Just do it. And prove to me that you did it 100%. Because if you don't drop 15 pounds this first month, then you didn't do it. I know if you're going to do it or not, because if you do it, you're going to drop 15 pounds the first month. And then you're not testing what I'm saying to do. You're not giving it a fair test if you do it, if you make some modification to it. Do it exactly, properly. And then let us use our skill and our expertise to convince you that you're going to love eating this way. And this is going to become the preferred way you're going to want to eat the rest of your life to maintain these benefits. But you're right. It takes time to achieve that. And people don't get a college degree overnight. They don't get a medical degree overnight. They don't become a world-class athlete overnight. Anything in life that has incredible value takes effort and time to achieve that. It takes determination, initiative, repetition, and persistence. Without those things, you're not going to achieve what you want to achieve. If you're ready to go, I'm ready to help you, though.
Well, this series is about cancer, and I didn't expect that I would actually sit here and be this inspired by what you're saying, but what you're saying makes very good sense. If you were to say one last thing to someone that wants to avoid cancer, that someone is dealing with cancer, wants to be healthy, what advice would you leave them? What inspiration would you leave them with?
I would say that's totally fake and phony to think that you're going to enjoy your life more eating the foods you're used to eating that got you into this mess to begin with. The idea that people say, I'd rather die quicker, just kill me right now if I have to eat so healthfully, that is a bunch of bull. Because people who are eating this way aren't enjoying food less, they're enjoying food more, and they start to be grateful for the food and appreciate the aesthetic structure and contents of the food itself. They start to see the beauty in the food. Their taste buds get better, and they say, wow, this passion fruit has it's incredibly subtly delicious. And they start to feel emotionally connected to the earth and to the food in a way that gives them more pleasure from eating, not less pleasure from eating. Their intellectual self gets joined with their emotional and aesthetic self, And the idea that they think they're giving up and losing to eat healthfully is why I want to diffuse that idea that the people we bring in, we teach them how to eat this way, and they start recovering from the disease, feel grateful for what they're learning, but they feel grateful for the food that the earth produced. They feel grateful for the people that prepared it and that planted it and picked it, and grateful for the fact that we have the ability to have such great food here in California or wherever you are that's shipped. What I'm saying is they become more satisfied emotionally with what they're eating, and they don't feel they're deprived. So don't think this is about giving up everything you like to get healthy. It's not. It's becoming more emotionally at peace as you get healthy and really enjoying what you're eating and appreciative of what you're being fed or what you're being able to eat now.
Well, I love that you started this journey. I love that you continued this journey. This was really terrific. Thank you.
Thank you, too.
Well, fiery, energetic, informative. Now that you are on the backside of this interview, what's your feelings about it?
This is one where you and I, when we're working, we both have a clock ticking in our head. It goes off, says, okay, this interview should stop now, not because of the information. Sometimes, you're out, and sometimes you just know this is longer than we wanted to go. This interview, I could have gone for hours. He'll be fun for us to do something with in the future to just produce more content, because there's lots more there.
As I say, for sure there's a lot more to cover, so we'll make sure we do it.